Hi, my name is Katie Weidlich, and I'm going to be discussing Chapter 10, Organizational and Work Role Competencies as discussed in Patricia Benner's book, From Novice to Expert. So just to start off with some objectives, we're going to discuss the background of organizational and work role competencies. I'm going to provide some detailed descriptions of each competency and explain how it relates to nursing. And lastly, I'm going to provide examples of professional and personal exemplars for each competency and kind of go over how it relates to the role of the nurse. So just an overview of Benner's domain in Chapter 10. It's very dependent on learning on the job, and this is especially important for new nurses because we're always going to be learning. So nursing schools, they try to provide us with the best managerial and leadership training, but is this enough to prepare us to work independently on a unit in a hospital? Some principles are taught by simulation and case studies, and while this is effective, it doesn't always capture the complexity of organizational demands that we experience in real life work. And lastly, according to Benner here, the new nurse must learn the local, the particular, the contingent, and the historical in mastering management and leadership on a particular unit. So just take a minute and think about all of our clinicals, including our leadership clinical, and decide whether you feel prepared enough to handle the organizational demands that nursing involves. So just an overview again of these competencies. The first one is coordinating, ordering, and meeting multiple patient needs and requests, and this is known as setting priorities. Number 2 is building and maintaining a therapeutic team to provide optimum therapy. And lastly, the third one is coping with staff shortages and high turnover. So the first competency, like I said, is coordinating, ordering, and meeting multiple patient needs and requests. And the main goal in this is setting priorities. This is something that we as new nurses will have to work diligently towards in order to gain a greater sense of salience, which is perceiving that some things are more important than others. And this competency focuses on the hurdle that new nurses face in organization and is usually seen in the evolution between the advanced beginner stage of nursing and the competency stage of nursing. So now I'm going to talk about these exemplars. The professional exemplar that I found was about the struggles that a new nurse dealt with when she was working with a full patient load. And I'm sure that we can all admit I am especially nervous for when I have to have a full patient load of 6 patients or more to care for. So it's really important to set priorities to overcome your disruption and organization of tasks. Now I'm just going to read a little bit from this exemplar. The nurse in this exemplar focused on the struggle of dropping everything she was doing just to get a patient a cup of water. Now this simple thing totally disrupted her organization, and she felt like she could never get anything done because she was constantly dropping whatever she was doing and was always running around. But she overcame this because after she started to set priorities, she learned that she can say to a patient, "Just a minute, I will come back." And that's exactly what she did, and that's how she overcame the constant disruption of getting different things that patients asked for. Now, my personal exemplar for this competency actually happened at my job, and I reflected and thought about this that happened just a few weeks ago when the COVID-19 crisis kind of put a damper on the way things are run at the nursing home that I work at. So we had to start feeding our patients in their rooms, and when you have 2 PCAs and 1 nurse feeding 37 patients, that takes a lot of organization and skills. And we really struggled in the first couple weeks because we constantly found ourselves dropping everything to run to get a patient a packet of sugar or a hot tea bag or a creamer or ketchup. And it was really frustrating because we could never just finish our work. We were always interrupted and always had to run back and forth. And I really connected with this professional exemplar because that was exactly what we were doing. So we had a lot of trial and error strategies, but the very simple resolution that we found that worked was to put a cart in the middle of the hallway where we served our patients that had all of the little things like the sugar and the creamer and the ketchup and the salt and pepper packets. So that way, when the patients were done eating, or we were done serving, we could just go and grab everything that we needed and take it to them in one simple trip. And it seems to really be working so far. So I'm glad for that. Okay, so the second competency under this domain is building and maintaining a therapeutic team to provide optimum therapy. This originally came from acute psychiatric settings, but it was found to be really essential for any therapeutic environment. And this is because it's not only for the patients, but for the survival of the health of the team members, because sometimes patient care is just too demanding for just one team member. So this requires a lot of give and take between the members of the therapeutic team. So my professional exemplar for this competency was titled Participant Observation, and in this exemplar, one colleague realizes that another nurse needed help. So I'm just going to read a little bit. It discusses team involvement, including all shifts. It's especially important because, in this example, a nurse was coming onto the shift and she started to help the earlier shift ventilate a patient when there had been a suicide during the night, and the nurse does this extra work on the new admit on the end of her shift in order to help the nurses on the previous shift. And I think that that's really something that we all need to realize is going to be necessary when we're in our new role as RNs, because it's so important to help out your other teammates, and just by the fact that she helped out for this day for this nurse and she stayed late and she did some extra work, then hopefully that nurse will realize that, and then the next time when this nurse feels overwhelmed, she can take some of the workload off and help her. And that's just reinforcing that whole give and take situation that we all need to be a part of. And my personal exemplar is not necessarily about a clinical experience, but just the whole overall fact that we are a team, nursing students. When we're in clinical, when we're in class, we have our study groups, we have our teachers who help us so much that we are one big team, and we all work together to help each other succeed. So my third competency is coping with staff shortages and high turnover rates. So this one is probably ones that we all relate to the most. Before I go into any detail, think about this. Think about a time when you were short-staffed. What was done about it? If you were on a hospital, was someone floated to your unit to help you? Or were you forced to expand your workload and care for more than the set number of patients that you were supposed to care for without any additional help? And I know as technical partners, a lot of you have dealt with this, where you've had to have more than, I think, the set 10 number of patients. And it can get very stressful. So now think about this as a registered nurse. Think about the responsibility of having extra patients, no extra help, and think about all of the room for error. All of the room for medication administration mistakes, or not properly identifying the right patient for the procedure, or not even getting the time to notice changes in health status. Things that are so important that get missed when there's staff shortages and people are overloaded with work. So Benner discusses some strategies that should help overcome and deal with staff shortages and high turnover rates. So just to start, the first one there is contingency planning, which basically means that nurses are responsible for assessing the most crucial patient and providing the most important care first. And we do this all the time with triaging. We know that Dangerous vital signs are really important. We know that it's important to change IV bags that are running dry. It's important to start those IV piggybacks. Pain medication administration, blood pressure medication administration, all of those things are really important and should be at the top of our list. Next would be anticipating and preventing periods of extreme work overload within a shift. And this really talks about experienced nurses and how they become adept to anticipate and avoid additional demands in their workload during critical periods. And we all know that this is during change of shift when things go crazy and there's always something going on that always holds up the process. Next is using and anticipating team spirit, gaining social support from other nurses, and this kind of ties into the second competency with a therapeutic team. A nurse that has a high patient load requires support, and the other nurses on the shift should be there to support the patient and support the nurse, and help them with their workload if they are overwhelmed. Then the next one is having a maintaining and caring attitude toward patients, even in absence of close and frequent contact. And if you're a nurse that has a high patient workload, you might experience this and not get to be face-to-face with your patient as much as you'd like to. Lastly is maintaining a flexible stance toward patients, technology, and bureaucracy. And I'm going to discuss this next in my exemplar. So the professional exemplar, this is an expert nurse, and she described how she clamped a chest tube when there were no clamps available. I think this is absolutely crazy. She states, I was the only person out on the floor, and of course they were out of clamps. So what she did was, she held it. She held it and clamped it. She yelled for help, had someone bring her a rubber band, and clamped it. She said she called the CRS and said, I need a clamp. I need a clamp set up right now. And they did, and she said, I couldn't believe it. And something so simple as not having a clamp really drives the force that we have to become adept to different situations. Now, my personal exemplar for this competency would be just an experience I had on a clinical unit where there was a staff shortage and a nurse had 9 patients. And I think she was really thankful that she had me because I was there to help her. I did some med administration on 2 patients, and I was really able to relieve some of the workload that she had. All right, just a conclusion. These competencies, they point out how demanding and complex the nature of the nursing role is in a hospital setting. Benner really reinforces the continuity and safe care that requires coordination and teamwork within a therapeutic team. It includes all of these competencies with team building. They require social integration before maintaining a therapeutic team, and we need that. And lastly, regardless of efforts to give a nurse the authority and autonomy that matches their actual responsibilities, the nurse needs to continue to achieve exquisite organizational and work role skills, which we will always be working towards. So I just have my reference here for the Benner book, and that's everything. Thank you for watching.